stop right now. If your knee hurts and you're about to swallow another painkiller, give me 5 minutes, just 5 minutes, to tell you something that might change your entire understanding of knee pain and how to deal with it. I am an orthopedic surgeon with nearly 30 years of experience. And what I'm going to tell you is based not on theories, but on thousands of real cases I've witnessed with my own eyes. Every day, people come to me with painful knees. And you know what I see most often? Not destroyed joints, not serious injuries. I see people who've been suppressing pain with pills for years, and in doing so, only making their knees worse. Because nobody explained to them one simple but critically important thing. Pain is not the enemy. It's a signal. And when you suppress the signal, you're not solving the problem. You're masking it, allowing it to grow in darkness. Let me tell you a story. 2 months ago, a man came to see me, 46 years old, middle manager. Let's call him Sergey. His knee had been hurting for about a year. At first a little, then stronger. He went to his GP, who prescribed non-steroidal anti-inflammatories. Sergey started taking them every day. Pain decreased, and he was happy. Continued working, going to the gym, living his normal life. But here's the problem. Pain decreased, but the cause of pain didn't go anywhere. Moreover, it worsened. Because pain didn't exist for no reason. It signaled that something was wrong with knee biomechanics, that certain muscles weren't working properly, that the joint was receiving incorrect load. And this incorrect load continued destroying cartilage day after day, month after month. Sergey didn't feel this destruction because pills blocked pain signals. He continued doing the same thing, moving incorrectly, loading the knee incorrectly, because pain didn't stop him. And pain is nature's safety mechanism. When something hurts, you instinctively stop doing it or do it differently. But when you remove pain artificially, this protection mechanism shuts down. When Sergey finally came to me, his knee was in terrible condition. MRI showed significant cartilage destruction, large meniscus tear, chronic inflammation. All this developed over a year of taking painkillers. I asked him, why didn't you come earlier when pain just started? He answered, but the pills helped. I thought everything was fine. That's the trap of painkillers. They create an illusion that the problem is solved. No, pain means everything's good, right? No, wrong. Pain isn't the disease, it's a symptom. By removing the symptom, you're not removing the disease. You just stop feeling it until it goes too far. But that's not all. Painkillers, especially non-steroidal anti-inflammatories, have a whole range of side effects many don't even think about. They irritate stomach lining, can cause ulcers and bleeding. They stress liver and kidneys, especially with long-term use. They increase risk of cardiovascular complications. And recent studies show they may even slow cartilage tissue recovery. Yes, you heard right. Drugs you take to relieve joint pain may slow healing of that joint. Because inflammation isn't only bad, inflammation is part of the recovery process. When tissue is damaged, the body launches an inflammatory cascade to clear damaged cells and initiate regeneration. If you constantly suppress this inflammation with pills, you interfere with the natural healing process. I'm not saying painkillers are never needed. There are situations when they're necessary. After surgery, with acute injury, when pain is so severe a person can't function. In such cases, short-term use is justified, but the key word here is short-term. A few days, maximum a couple weeks, not months, not years. So what to do instead? If knee hurts, if pain interferes with life, what then? Here's what I want you to understand. Pain is information. It tells you something's wrong, and your task isn't to shut up this signal, but to figure out what it's reporting and eliminate the cause. When a patient comes to me with knee pain, the first thing I do isn't prescribe pills or order MRI. The first thing I do is watch how the person moves. I ask them to walk, squat, stand on one leg, step up. And in 90% of cases, I see the problem immediately. Some muscles aren't working, some are over-tensed, biomechanics are disrupted, knee receives load it's not designed for, and then we start working not with pain, but with the cause of pain. We activate sleeping muscles, relax over tense ones, correct movement patterns, strengthen stabilizers. And you know what? In most cases, pain starts going away by itself. Without pills, because we eliminated the cause it arose from, this isn't quick. This isn't as easy as swallowing a pill. This requires time, effort, discipline. But it works, really works. Doesn't mask, but solves the problem. I had a patient, a teacher, 51 years old. She took ibuprofen every day for 3 years, every single day. Her stomach was in terrible condition, ulcer started, but she continued taking pills because without them, she couldn't stand at the board, knees hurt unbearably. When she came to me, I told her, we're stopping painkillers right now. She got scared. But how will I work? I answered, we'll find a way, but continuing like this is impossible. You're destroying both stomach and knees. We started work, turned out her glutes and inner quadriceps practically didn't work. All load when standing went straight to knee joints. We started activating and strengthening them. First week was hard, pain, even intensified because body was withdrawing from constant anti-inflammatory dose, but she held on. After 2 weeks, she felt first improvements. After a month, pain decreased by about 60%. After 3 months, she could stand at the board all day with almost no discomfort. Without a single pill, her stomach started recovering, knees became stronger, she learned to stand correctly, distribute weight correctly, activate muscles correctly. This is exactly what I want to convey to you. Painkillers are a crutch. Sometimes a crutch is needed to get to help, but if you walk on crutches for years, your legs will atrophy. Same with your knee. If you suppress pain with pills for years without eliminating the cause, your knee will only deteriorate. There's another important point few talk about. Chronic painkiller use changes your pain perception. Body adapts. It requires more and more drug for the same effect. So-called medication dependence develops. Not in psychological sense, though that happens too, but physiological. Your pain management system recalibrates, and without pills, pain feels stronger than it was initially. Moreover, there's a phenomenon called rebound pain. When you take painkillers long-term, then stop, pain returns with double force. Not because the problem got worse, but because body loses ability to cope with pain on its own. Its natural pain control mechanisms, endorphins and other substances, stop producing in needed quantities because pills did their job. So, what to do if knee hurts right now? If pain is severe, if it prevents sleep and work, here's my protocol I give all patients. First, ice. 15 minutes of cold on the painful area will reduce inflammation and dull pain naturally without chemicals. Can do this several times daily. Second, rest but not complete. Don't load the knee with what causes pain, but continue moving gently. Complete immobilization only harms. Gentle pain-free movements help joint fluid circulate, nourish cartilage. Third, find a good biomechanics or functional testing specialist, not just a doctor who will look at an image and prescribe pills, but a specialist who will assess how you move, which muscles work incorrectly, where imbalance is, and start working on eliminating this imbalance. Fourth, if pain is truly unbearable, use painkillers but minimally. Minimum effective dose, minimum time. Not every day, only when absolutely necessary. And simultaneously work on the cause to abandon pills as soon as possible. See the difference between my approach and what most people do? Most treat pain, I treat the knee. Pain is consequence. A knee that works incorrectly, that's overloaded, that's not protected by muscles, that's the cause. Eliminate the cause and consequence disappears by itself. In nearly 30 years of practice, I've seen hundreds, if not thousands of people who sat on painkillers for years thinking it's the only way out, and saw how they freed themselves from pills when we found and eliminated the real cause of pain. Their lives changed. Not only because pain went away, but because they understood their body can heal itself if given right conditions. So before you swallow another pill, stop. Ask yourself, am I treating pain or am I treating my knee? Am I masking the problem or solving it? Am I ready to spend time and effort to truly heal, not just temporarily, not feel pain? Your knee talks to you through pain. Don't shut its mouth with pills. Listen to what it's trying to say and give it what it really needs. Not chemicals, but proper movement, strong muscles, correct biomechanics. This is the path to real healing. Long but reliable, and your body will thank you.